Welcome, my friends, to the Bob and Brad podcast, produced by Bob and Brad, the two most famous physical therapists on the internet. I am Bob, and I'm exactly one half of the Bob and Brad team. Today, I'm going to be joined by our guest, Dr. Anuja Mathew. She's a physical therapist with a doctorate in physical therapy and a master's degree in physical therapy. She also is certified in orthopedics with an orthopedic clinical specialist certification, and that's earned by only 5% of the physical therapists across the country. She's also trained in women's health and pelvic floor. She's been in practice for 10 years. She's kind of an expert on women's health conditions such as urinary incontinence, pelvic pain, pubic symphysis dysfunction, diastasis recti, prenatal and postnatal rehabilitation. So we'll get into a lot of those subjects today. Please join me in welcoming Dr. Anuja Mathew. I wonder if we could switch topics now and we could start talking about the topic of diastasis recti.
Yeah.
Called diastasis recti or rectus? Or
so it's diastasis rectus abdominis. That's the whole diagnosis of it. But people also call it diastasis recti. Or DRA, or most women will call it the mommy tummy or the pooch that they have postpartum. So they might connect more to that.
Well, so who can get it? I take it obviously pregnant women can get it.
Believe it or not, I also have a few men that I treat who have diastasis. Yes. They usually come in with low back pain, not knowing obviously that they have diastasis. And I usually, when I see them, when I'm assessing them, I tell them that yes, we assess and we check for it, and they have diastasis. A lot of heavyweight lifters or people who work out at the gym a lot, they have it too.
Right.
But coming back to pregnant women, they are more prone to having it. I would say around maybe 60% of pregnant women will have diastasis, just because, your belly is stretching out so much, your muscles are stretching out so much. So the rectus, that's joint in the middle, when your belly is growing, it just kind of, the connective tissue that's there is just stretched out.
And that's pretty much the definition. I mean, we didn't really provide a definition for those of you who are listening or watching. That would be, I know there's a test that pretty common that you lie on.
The test is pretty common. It's very easy for anyone to do at home. And I do recommend most postpartum women to test this themselves. It's very important to know whether you have it or not. Just to start with some exercises or precautions that you can take. It's a very easy test. You lay down on your back, back is relaxed and flat. You bend your knees, you take 3 fingers, just like that, put it straight down on your belly button, and you're gonna check 3-4 different levels. So you can start up from above your belly button. You just keep your fingers down there, and all you do is lift your head and shoulder up. A little bit of your shoulder. You're not doing a curl up, you're just lifting it up a little bit from the ground. If your fingers dip in, then you have diastasis. It also depends on how many fingers dip in. Like sometimes it could just be like one finger dipping in, sometimes all 3 would dip in.
Sure.
All it means is how wide the opening is, or the diastasis is.
Gotcha. So, I'm going right down my questions here. And you said something about prevention. Can you help prevent it?
No, I mean, if you're pregnant, there are very few things that you can do to really prevent it. But yes, if you have good core strength, or you're using good activation techniques, not just doing crunches, that's not just building your core strength. Actually using your, what we call the transversus abdominis muscle, or the multifidus, and the diaphragm all together. If you're able to activate that throughout your pregnancy, that could definitely help reduce the chances of getting diastasis. The other thing that I do recommend, especially if you're an athlete or if you're working out, if you're a runner, to try kinesiotaping for the belly that's growing. So it's a simple technique. You can also find it online. You just put 2 strips of the kinesio tape next to your belly button, starting from where you feel the starting of your belly till the end. And then you just go across horizontally with each strip in one direction, then the other, just kind of bringing it together. And honestly, this can be done either during pregnancy when your belly is growing, and even postpartum, it helps. Just to kind of keep it together, or at least get the feedback to bring the muscle belly together.
That's a fantastic, again, not my area of expertise, and that's very helpful. It's one that's easy to apply, and that tape
and you can definitely do it yourself. Yeah, it's very easy. There's no positioning of any muscle required. Something you can practice at home by yourself.
With diastasis recti, are there complications or health implications of it? I mean,
yes, definitely. I mean, if it gets worse, if it's really bad, you could get a hernia or an umbilical hernia that you have. These patients obviously then will require surgery, because just treating them with physical therapy is not going to help. The other symptoms that you would notice is low back pain. Most people come in with low back pain because your diastasis, your muscles that are actually supporting your spine they don't have enough tension anymore. So when you stand, you walk, it's all going to strain your lower back. So a lot of people come in with low back pain and they have diastasis. Hernia is one. The other thing people notice is constipation, indigestion. Like they feel bloating right after they eat. Basically, all your organs are behind the muscle that's there, and it could actually make it either push out when you're too full, or your digestion is going to get affected because it's not moving the way it's supposed to, because there's not enough tension there anymore.
Makes complete sense. Your abdominals are kind of your natural binder for your back.
Yes.
If you've got a cut in your binder, it's not going to provide support. But it's interesting that you mentioned this now. I know a guy who I think had it, and t-shirt even. And
a lot of men, they think they have a beer belly. Most of them probably have diastasis.
Right. Yeah, it was the strangest thing I'd seen. So now, can you describe some of the exercises that you do, like postpartum?
Yes. So the first and foremost thing I should talk about is the main thing to control is the intra-abdominal pressure that's built up. And the best thing to take care of this is to do diaphragmatic breathing or relaxation, or the right technique of breathing, which will avoid creating this increased intra-abdominal pressure, trying to push things out more. So definitely start with diaphragmatic breathing. It's the easiest thing to do. All you do is when you breathe in all the way in to your belly, feel the air go down to the bottom of your belly. And when you breathe out, you imagine breathing out or blowing out a candle. Like, when you're doing that, you're actually also activating your transversus abdominis, which is one of your core stabilizers or your primary core muscle. So you can do this maybe once a day, maybe 10 or 15 repetitions. You don't go crazy with it. You're not doing it all day just because it's a relaxation technique. You're just doing it 10 to 15 times. Deep breath in through your nose, breathe out through your mouth, like you're blowing out a candle or blowing into a balloon. That's one of the things.
I imagine what you're trying to prevent is someone who's more of a chest breather. They could have abdominal tight all day.
Yes.
Is that correct?
Yes. Also, someone who's a chest breather doesn't have enough excursion of your diaphragm, which also causes a lot of abdominal tightness and wrong recruitment of your muscles, really, when you're breathing in and The other thing that you mainly do for diastasis is a head lift with bracing. So you're lying down in the similar position that you're testing your diastasis. You're flat on your back.
Right.
You have your legs bent, your feet flat on the floor. You can either use your hand to approximate the true belly of your diastasis or your rectus, or you could use a towel wrapped around your waist. So you're kind of pulling it almost like a corset or a binder that you make. You could pull it not too tight that you're actually strangling your belly, but just enough to approximate it. And then you do the same thing that you did for the testing. You lift your head up and a little bit of your shoulders up. And that's the most important exercise for your diastasis. You're bringing the two.
Repeat that?
You could do it 10 to 15 times, each time holding for about 3 to 5 seconds. Make sure when you're doing this, you're not holding your breath, because that's exactly the opposite way of what we're trying to do here.
Oh, sure.
Holding your breath will just increase your intra-abdominal pressure more. So you're breathing out when you're coming up. And ideally, anyone could breathe out probably for 5 seconds. I would say just hold it there till you completely breathe out, and then you go down. Take a normal breath and then repeat it.
So you said you could do this with your hands too? You could.
Yeah. At the clinic, I usually have patients just use their hands like at the belly. You just bring them together. You feel the muscle working. You feel the belly coming together, belly of the two rectus coming together. You can do it that way too. The ideal way, they say, is to do it with the towel. But I really found that the patients respond well with them using their hands to bring it together. Just
because then they're getting the feedback too.
Yeah,
right.
Yeah, and they can feel that muscle. The other thing with diastasis is we're not trying to close the gap. We're not trying to bring the two muscle belly together. All we're trying to do is increase the tension in the muscles. So when you have to use it, it's not loose and elastic. It now has more tension in it.
Makes
so
sense.
along with your rectus, you also need the muscles around it to have enough tension. So definitely add more core strengthening to it. And also some of your oblique strengthening to it.
Gotcha.
I would say if your diastasis is really bad, definitely see a PT, but at least start doing like the basic things that you could with breathing and the head lift technique.
Do you do some side planks, or do you have a go-to for?
So planks, it's a good question. With planks, usually when you are pregnant, and doing a full plank could actually put more strain on your belly. And could maybe worsen your diastasis. There's not enough research on that yet, so I cannot tell you for sure. But we do use a modified plank technique where you put your knees down and you go into a plank.
Gotcha.
And going into a side plank, similar way, you start with your knees down and going in a side plank. Yeah. Postpartum, obviously your muscles are weak, so you don't want to jump in right into doing all the heavy stuff. So start with really basic stuff where you're just doing gentle core activation. You can slowly go to the modified side plank, modified plank, and then eventually progress to a full plank and a side plank.
Gotcha. Yeah. Well, do you feel, I mean, I don't know if you track this at all or not, but what's your rate of success with the diastasis recti? I mean,
so I know I said that we're not trying to close the gap, but I have seen patients, if they have like 3 finger distance, it has come down to 2 or 1 finger, which is great, which to even get down to that is a lot. But it also takes a long time, a lot of dedication, a lot of homework from the patients as well. And when I say long time, it could be anywhere from 8 to 12 weeks or even beyond that. That's for any muscle.
Sure.
Yeah.
You almost need a fitness-minded person to
get to that. But I have seen good success and good results.
Is there, again, I'm sorry if this sounds really ignorant, but is there any soft tissue work you do on it as far as the scar tissue there, or
Not really working on the diastasis that's stretched out, but visceral mobilization really helps. It's a soft tissue. It's not a mobilization of your soft tissue, but your viscera that's in your abdomen. That helps. Also do some work on your obliques and your psoas. So release in that area more than releasing the scar tissue. The scar tissue release comes if you have a C-section.
Sure. Makes sense.
Then you definitely work on that scar tissue and you release that, because that's going to have adhesions to your surrounding tissue.
With the visceral adhesions, will that be a source of pain sometimes?
No, only because your viscera is challenged so much with the diastasis. As I said, with all your organs pushing out and there being increased intra-abdominal pressure. So visceral mobilization could help with some of these patients. Also, if they have an issue with constipation, so you can at least address that with the diastasis. So not really working on the scar tissue of the diastasis, not something.
Gotcha. That makes sense. That makes complete sense. So really found it surprising, the whole back pain issue, but it makes so much sense that
most men, they're like, but how could I have diastasis?
Yeah,
I wasn't pregnant.
Yeah.